I'm here today to talk to you all about pain. Who in this room has pain? Raise your hands.
Me.
Does it affect your activities of daily living?
No, I got back to the hospital.
Just got back from the hospital with pain?
Yeah.
All right. The way you perceive pain may not be the same as the way she perceives pain. Right? We all perceive pain differently.
Yes.
You believe that? You think that's a correct statement?
Yeah, I know ain't all of them ain't the same. I know mine ain't.
Yours ain't the same as everybody else's?
Mine ain't the same every day like yours.
Oh, it ain't the same
They're
every
different.
day.
Different pains.
Okay. You know there's a different pain. There's a physical pain where you may have fractured an arm or fractured a leg.
Yeah, I fractured it.
Right? There's also a mental pain.
Yeah.
If you lose a loved one, that's a pain in your heart that you can't get over, right?
That's
You
right.
deal with that daily. So they are different types of pain.
Yes, they are.
Some people perceive pain differently when they've lost a loved one. Some grieve for days, some don't grieve at all. Correct?
Yeah.
All right.
I reckon.
You reckon? Pain is what an individual says that pain is. If you told me your back was hurting, I couldn't say, no, it don't, because I don't know what you feel, right?
That's right.
If you said you had back pain, I would have to believe that you had back pain.
That's right.
That's right. Pain can be chronic or acute. That means you can be in pain longer than 6 months or less than 6 months. Is anybody in here in chronic pain? They've had pain for over 6 months? You have? Now, acute pain is something that just comes on suddenly. And then maybe you can take some pain medicine for it and then it goes away. Chronic pain is you may be taking medication every day for that. You never get rid of it. It's there always. Okay?
Yeah, you're right.
Do you know what the definition of pain is?
Hurting.
Yeah, it's a physical suffering or discomfort caused by illness or injury. Right? Pain can also be mental, losing a loved one, or telling someone something that is hard for you to say that you know is going to hurt them.
That's right.
Right, right. People react to pain differently. Do you believe that? If you broke your arm, how would you react?
I'd cry.
You'd probably cry for a couple of days. Mr. Akins, if you broke your arm, how would you react?
I try to get back together. I've had so much, I don't know.
Every person in this room has a different tolerance for pain, correct?
Yeah.
She may have broken her arm and it may hurt like a 10.
Like a what?
A 10. We use a pain scale to rate your pain.
Yeah.
A 0 to 10. Let me show you. If you were to go to the doctor or the hospital, Mr. Akins, you just said you went to the hospital. Did they ask you to rate your pain there?
Yeah,
And what did you tell them?
till me.
Is this the scale they used?
I don't know. I don't got
Was there little smiley faces?
They got 2 or 3 papers.
So 0 means you're not in any kind of pain. 10 means, you see the face of the frown? 10 means you're in severe pain.
That's right.
All right? This is the scale that most doctors' offices and hospitals use today, and the nursing homes. Are you asked daily how your pain is? Does anyone in here have pain daily?
Yeah.
I was with my mother on mine hurt.
Yours hurts all the time. Okay.
Mine does too.
Okay, when you go to a doctor, here are some of the things they may ask you about pain, all right?
Yeah.
They may ask you how and when the pain started,
Mm-hmm.
all right? They may say, where is the pain located? They may ask you how long you've been in pain.
That's the reason I go to them, to try to find out.
They're asking you, but you really want them to tell you, don't
Yeah,
you?
supposed
Yeah.
to. The way I look at it.
They may ask you the frequency of your pain. Do you know what that means? Do you have pain every day? Do you have pain in the mornings? Or do you just have pain at night?
You have pain at night.
Does your pain ever go away?
Hurts so bad at night I can't rest.
The intensity of the pain, that goes back to the pain scale, the 0 to 10. How severe is your pain? The quality of your pain. Is it bad? Is it mild? Is it severe?
Mine be about 7, I guess.
Be about a 7?
Yeah.
They may also ask you, are there any symptoms associated with pain? Do you have fever, nausea, vomiting, fatigue? You just feel real bad?
Yeah.
Okay. Does the pain interfere with your activities or sleep?
Sleep.
Do you hurt so bad sometimes at night you can't go to sleep?
That's where I was last night.
That's where you was last night. All right. And they may also ask you what improves or worsens your pain. Is there anything that you can think of that makes your pain worse?
No, I don't
Getting up in the mornings. If you have arthritis, when you get up in the morning, sometimes it may be difficult for you to get your hands going and your feet going
Yeah.
till you stretch.
Mhm.
Okay?
You got to stretch.
Right. There's treatments for pain such as pain meds. You also have topical ointments that you can put on for arthritis. Right? Does anybody in here take pain meds or put on ointments?
Yeah,
For
I
their
do-
pain?
I do every night.
Okay. You also may want to just relax or get a massage or use some cold packs, some hot packs. All right? So pain affects people in their everyday life.
That's right.
Would you agree?
Yeah.
Okay.
Mm.
And how we perceive pain is different. Do you think we've established that? How you perceive pain is different than how he perceives pain.
I don't know how to explain it.
You don't know how to explain it?
No.
Like when I was talking about the broke arm, she said she would cry for days. You said that you would try to get yours fixed. You didn't mention crying. So see how that's different? Right.
I cried last night, but it didn't no good.
Didn't do you no good to cry. You still hurt.
Yeah.
So how many people in this room live with pain every day?
Me?
Every day. And what do you do for it?
I don't do much of nothing. There's nothing to do. I don't reckon.
Just take your pain meds. You just have to live with it.
Yeah.
All right. Does anybody have any questions?
Any what?
Questions?
Oh, quick.
Anything to clarify? You want to look at the scale one more time?
Just like it is in my legs and ankles swelled up. Both of them. I can't get under pressure. I ain't yet.
So if I asked you what level of pain you were in and you thought you were in severe pain, what number would you give me? If you hurt really, really bad, on the pain scale of 0 to 10,
I call it about 7 to me.
you'd say 7.
Yeah.
What about you? If you hurt really bad according to this scale,
I hurt really good night. I don't know. darling.
you'd be about a 10, wouldn't you?
Yeah.
Yep. Yep, you'd be about a 10. All right, if no one has anything else, that's going to be it for today. All right, I want to thank you all for participating, okay?
I appreciate it.
All right, thank you.